We are very fortunate in our office to have some special equipment for taking x-rays of the temporomandibular joint. This is a picture of a tomogram x-ray machine. Okay? This is not part of a normal dental office. It's a dental office that treats a lot of TMD patients like we do. So we're very fortunate to have that machine taking x-rays of the jaw joint. All dentists take x-rays of the teeth, but we take x-rays of the teeth and the jaw joint because we treat jaw joints. There's a patient standing in the machine having an x-ray taken, tomogram x-ray machine. So that's what the tomogram x-ray looks like. Okay? So here is the lower jaw coming up when the patient bites on their back teeth. And that little black circle right there is the ear. And we measure the space between the back of the ear and the jawbone. And there's not a lot of room there. Remember I told you that it's should be 4 millimeters space there. On the other side also, it's very back, too far. We call that compression of the nerves and blood vessels between the back of the jawbone and the ear. So if that patient comes in like that, they always have jaw joint problems. They could be clicking, they could be locking, they could be in a lot of pain, they could have all those symptoms we mentioned, the headaches and the tinnitus and all those things we mentioned. So we can make a partial diagnosis on the position of the jaw when they bite on their back teeth by taking the tomogram x-rays. Here is a before treatment photo. A before treatment tomogram showing the top of the jawbone is too far back. See that jawbone too far back. Then we put the splint in. The lower splint covers the lower teeth and opens the bite and moves the jaw forward. So here you can see in this photo, the top of the jawbone is in the correct position. See, the top of the jawbone is here, the ear is here, and there's a large space right here. So remember, in that space are nerves and blood vessels. So initially, every time the patient bites down, 2,000 times a day, they're compressing the nerves and blood vessels between the back of the jawbone and the ear. Not good. Now we've got it fixed. We move the jaw to a different position, putting a plastic splint, acrylic splint, covering the lower back teeth, which moves the jaw to a more comfortable position. Okay, and that is worn all day long because anytime we take it out, the patient's going to bite back on the nerves and blood vessels back there and cause symptoms. And we've gone through all the symptoms previously that can be caused by that. Okay, so there's the right position, that's the incorrect position. Remember, with the patient biting in their back teeth, you have to take the x-ray. You can see it's circled right here. Circled nicely there and circled right there. So you can definitely see the difference in the spaces. It's extremely important to be able to take these x-rays to make a proper diagnosis, in my opinion.